Rachel is now demonstrating the Mackenzie regime of lumbar extension. So what we're looking at is, to start with, you're going to lie on your tummy. We've put a little towel under her forehead so she can actually still breathe without turning her head to one side. So it may help with some people, they like to have a pillow underneath their feet, so do consider that, it can make you more comfortable. So you're going to lie in this position between 5 and 10 minutes, just to allow everything in your back to settle. And then we're going to actually do some what we call static extension. So Rachel is actually just going to put her hands underneath her and come up into that position. So she's actually letting her back just gradually sink down towards the bed to make sure her hip bones still stay on the bed in that position. Now you can use breathing, which helps you relax. So you can do a nice deep breath in, and then as you breathe out, you just let the back drop that little bit more, and that's known as doing a sag. Right, so if you want to do this and you can't lie up onto your elbows, you can easily put a couple of pillows there under your chest and rest on those and gradually build them up. Start very small and gradually build them up. So Rachel's going to go down again now, and then she's going to show you how to do the extensions in lying. So in this case, you can either put your hands just under your, you can either start with them under your shoulders, or you can have them a bit further forward, as Rachel is here now. Okay. So Rachel's basically just going to push up and down and then slowly go down. So you can see she goes all the way back down to flat again. So you can see that her back there is going really flat. And then she'll do it again slowly. And then just push up. And each time she's going a little tiny bit further. That's it. And down. So if you do, say, 10 of these, then have a little relax. See if the back pain is actually reducing, and certainly if you've had any pain in your leg, the pain should not be getting worse as you do these exercises. It should be reducing, even if the pain in your back actually gets a little bit worse, as long as the leg pain goes. That's the important thing. Going all the way down. So on the next one, you imagine this one now is number 10, so you do 10 of these. So on the 10th one, Rachel would go up as far as she could, which should be a little bit higher than on number 1, keeping the hip bones down. Going to do a nice deep breath in, and as she breathes out, she drops her hip bones a little bit further down towards the bed, and that's called a sag. But your physio will talk through this, whether you need to do those or not, and then go back down to flat. We always suggest you lie a minute or two before you get up after doing these, just to allow everything to settle down in your back.